Welcome back to the Evolution of Dental podcast, brought to you by Evolution Dental Science. I'm your host, Rob Norton. Today, we're joined by a doctor who's adopted a lot of digital technology in his practice, Dr. Brian Olitsky. Dr. Brian, how are you?
I'm doing great. Thanks. Thanks for having me. This is exciting.
Thanks for being here. How's sunny South Florida?
Sunny South Florida is sunny and warm today.
So you adopted exocad. You've had exocad in your practice a couple of years now. Why exocad?
So it's been a little over 3 years. exocad I saw as the premier software to use. I was only familiar with maybe one other software that seemed like it was really tied into a specific scanner, but and exocad was open, and the amount of opportunities to use it seemed like was greater.
I'd agree with that. That's kind of what got me into exocad, is just the openness of it and the infinite flexibility of exocad. What are some of the applications you find using it? Like how has your experience with that changed? Like what were you first producing when you first adopted exocad versus what you're doing now?
Well, I first got my toes wet in exocad just by designing my own night guards. So I thought that was a great way for me to get started. I could easily scan, and it got me into printing as well. Purchased a printer and exocad basically at the same time, and just said to myself, what can I do that could be simple and easy, something that I use every day? And designing my own night guards was the answer, and it just blossomed from there. Now I use it for same-day milling and crowns, and crowns, inlays, and onlays. And I do my own digital wax ups. I could do same-day wax ups, so I can do repairing traumatized teeth and that kind of thing. So I use it every day.
Every day. How's that changed your interactions with the patients? Is it like a value add there? Is it a plus? Is it something that complicates things? How's that work for you?
You know what? It's really been a value added to the practice. So patients really see it as I'm on the cutting edge, and I'm being able to provide them with the latest in technology. And same day dentistry is definitely something that they're really happy to have.
That's excellent. So were you doing much same day dentistry before you had exocad? Is that something that you were just trying to branch into?
So before exocad, never. I never owned a mill system. I have awesome laboratory technicians that wax up and press and do some really beautiful work. And I said to myself, I really can't provide that level of artistic ability. And so I never got into same day milling. But by using exocad and being more comfortable and familiar with the process, and then the price point of milling had really come down. I thought it was a no-brainer to get started in it. I don't use it for everything, but same-day restorations is definitely something that my patients are really excited to have.
That's really awesome. What do you, may I ask what kind of mill you're using?
Yeah, I have the VHF E4 mill.
Okay. Yeah. Those are good for that kind of work. Absolutely.
Yeah,
Is that what you stepped in with first?
that's my very first mill.
Very first one.
Yeah, I did. I did get into crown printing when SprintRay came out with their crown platform. So that was my kind of first move into same day restorations, trying to print them on my SprintRay using their crown resin.
Is that on like one of their like pro printers, or is that on the new Midas system?
Actually, it was their Pro 55S. So I think it was their first pro printer. They said that was the one to use for same day crown printing before the Midas.
Before the Midas.
Right.
How's your experience been with that? Is that replacing your need for milling in any way? Is it more of a temporary thing? Like what's
So the printing, the crown printing, what got me into the milling. So the crown printing was really cool and great fits, and the process was pretty easy. But the aesthetics, the durability of the crowns, there's no way that that was going to match milling and Emax, milling. So, um, so after after doing several prints on with crown prints, I was like, man, if I'm going to do this, I'm going to take it up a notch and go to a mill, designing my own restorations. And then whether it was printing or milling, it didn't matter from that point.
That's really cool. What's next for you there? What's on the horizon for you? What are you excited about?
So right now, my desire is to get better at implant planning, implant placement, implant guides, and then moving that into milling my own abutments and crowns. So I can see that as my evolution right now. That right now the E4, the VHF E4 I have it just as a ceramic mill, just for glass ceramics. And I would have to jump to the next mill to get into like the titanium mill, and maybe getting into like some puck milling or doing some zirconia milling. So I see that as the next evolution for me.
That's what's on the horizon for you. So
Yeah.
you do a lot of implants in your practice?
So I don't do any surgery, so no placement of implants. For me, it's just having that control over implant placement and outcome is what I'm excited about. I've got great surgeons that I work with that they can manage all that, and as long as I give them where I want the implants, then I feel that that's a win-win for both of us, for the team.
Yeah, that's really cool. It sounds like exocad's helping you work more closely with the rest of your team that's outside your practice, like your technicians and your surgeons, and so that's leading to better outcomes, right?
Yes. Yeah, I'm really excited about having the exoPlan software, and I just got a CBCT, so I can actually do my own CBCTs in my office and go right to planning, and not have the downtime of waiting for that data to come from the specialist.
Right. So you're able to work much more closely with the specialists.
Like specify what it is that your target goal for each case is. Sounds like.
Yeah, I can get planning like right away on stuff like that. Come up with my treatment plan and outcomes before um, I'm waiting for patients to come back from specialists.
This is almost like a communication tool for you as much as anything else.
Absolutely. Yeah. Yeah. Doing that, using exocad to do my like the digital wax ups. I can share my plan with my specialist, and I can say, what, this is where I want the restoration to end. So this is how we're going to have to get the implant in.
What's one of the weirder, wilder situations where that came in handy, like clutch, as the kids would say?
Uh, The clutch is like anterior implants. So anterior implants are tough. The soft tissue might look like it's there, but once you've overlaid a scan with a CBCT, and you see, oh, the soft tissue may look like it's there, but the bone isn't. And then that's like, oh, stop the brakes. This is going to need a little bit more planning. This is not just a straight implant placement. That's where it saved me in my practice.
Awesome. So instead of having to fight with your oral surgeons, you're working side by side with them. Like you can see what they're seeing and vice versa, and you can plan it
Oh
together.
yeah. Oh yeah.
That's really awesome.
Yeah, exactly. Yeah. I think we appreciate that level of detail too. They like to know that they're not going to have to wing it or cowboy it. Though they have some level of predictability that's coming.
Predictability is what we want,
Yeah.
especially in dentistry,
Yeah.
where there's always variables and everyone's different. Every case is different. So that's definitely a powerful powerful way to eliminate that variable.
Yeah, if I can make things a way more predictable in practice, that makes life easier for everyone, including the patient.
Including the patient, maybe especially the patient. That is that one of the things you'd say is part of your practice's secret sauce?
Yeah, is predictable outcomes. Managing expectations of patients, and I can look at a patient and see their smile and have a vision for them. But if I can't, produce my vision for others to see, then it makes my job less predictable.
Less predictable, and it turns your vision into something that can be, well, picture's worth 1,000 words, right?
Yeah, but exocad not only creates a picture, but it actually can create the hard diagnostics, which is just still blows my mind that I can turn a scan and then start working in a CAD software and generate a 3-dimensional model from that is detailed and exact. I'm like, who thought of this? Wasn't me.
No, but it's all because of people like you who are using it, who contribute to the usage of it and the feedback. It's been a community effort with exocad. This feedback that's turned it into the powerful tool that it is today. Truly. What would you say to folks that are still kind of on the edge of like, I don't know if I need that kind of tool in my practice?
I, it's the way that dentistry is really going. So to avoid it now just means that you're going to be further behind the curve when you do get into it. If you're an older dentist, such as I am, I consider myself in the later stages of practice, even though I look young. Um, and it was only a few years ago that I decided I'm gonna jump in with both feet into digital dentistry. I just didn't want to be left behind. I didn't want to be still practicing, you know, dentistry that was decades old. I didn't want to do that. I wanted to, even if I was going to work another year, another 5 years, I wanted to go out, on the tech curve. I don't want to be left behind. So, you know, I say anybody that's not into digital dentistry, first thing that you got to do is you got to get a scanner. If you don't have a scanner and you're still taking impressions, PBS impressions, then get a scanner and start digitizing. It's not hard, and the entry point is so much. There's so many more scanners now than when I got started. I actually started scanning over 15 years ago with iTero, and it was really, for scanning, it was really rudimentary, but just the evolution into scanning today has been leaps and bounds. But get into scanning and then get exocad and just see where it can help you, and where you can start, you can just learn little bits and pieces of it. You don't have to use the entire software. I mean, it's unbelievable what it does, and just baby steps, taking baby steps, getting into it. But yeah. And I mean, honestly, it's where dentistry is going. I mean, uh, I say I won't see the robot era in dentistry, but I think it's coming, and it's going to shock it. It's going to shock everybody when it gets to us. But
I think it's coming faster than anybody really appreciates.
yes, I agree.
Have you worked with the AI crown generator through exocad yet?
I have. Yeah.
What do you think of that?
I think it's awesome. I mean, streamlining it, making it quick, quick and easy. And if you have something that doesn't need a little bit of design nuance, or, I mean, you can even take an AI generated crown and customize it. So even that's cool. It just workflows really quick when you use the AI crown.
Huge time saver for you then.
Huge time saver.
Are your assistants working with this, or is it are you just focusing on exocad on your own?
I'm doing it on my own right now. Kind of savoring it for myself, But they're helping me with printing and milling. So, they're really good at that. And I really want to start to introduce them into exocad design. I think that they can do it. I think they're more than capable. Because I've always been kind of a controlling, not a controlling person, but I always want to control outcomes. So when it comes to anything that I'm going to put in a patient's mouth and it's going to be, bonded and it's going to be there a while, I want to make sure that it's got my initials on it.
Yeah, that makes sense. I mean, ultimately, it all comes down to the captain, right? And like dental practice isn't a cult of personality outside of DSO, of course.
Yeah.
Yeah, buck stops with you. So no, I absolutely respect that. You gotta control some of the process and make sure that the outcomes are what you expect them to be, for sure. Is there anything about getting into this that you would have done differently?
Good question. Um, I think that I would have other than starting sooner, that would have been ideal. Um, but the way that things just kind of organically grew with me in the practice, I don't really have any regrets. I would have liked to have started um, milling a little bit earlier, getting into that. But really, the fact that the equipment is starting to become a bit more reasonably priced help get into that area. Um, but now there's just there's new printers out there. There's uh, printing dentures. You know, if I were more comfortable doing surgery, dental surgery, then maybe even getting into my own implant placement and design process, that would have been pretty cool. But I'm really happy with the way that things worked out for me so far.
A lot more approachable with the prices. I mean, not only are they go from being one or two really truly viable scanners just maybe as recently as 5 years ago to now there's at least half a dozen of them out there that are, as much as $10,000 underpriced from where they were, and
Yeah.
very competitive and many, many more open options, which of course makes them very compatible with exocad. Not that exocad doesn't take any players, but some other ones that, are a little bit more exclusive, we'll say. Um, that's pretty cool insight for sure.
Yeah. So definitely, if you're, if you're not thinking about it, then you should be, getting into the digital realm of dentistry. If you haven't started, you gotta get into it. If you're already into it, then dig deeper. There's, I think there's a lot of training out there that'll get you where you want to be. I think that's exciting part too, where a few years ago there was nothing, for training in the digital design world. And there's several big players out there that get you, that can get you caught up to speed.
Absolutely. And I'm very glad to have met you in one of our little exposés on that, debuting the new 3.3 version of the software actually in Buffalo.
Yeah. So it's very cool. I was happy to be there. That's another thing. It's like you guys having the knowledge and the ability to train, um, and do it at multiple levels. Like, I don't consider myself a higher level of exocad expertise, but you can hit wherever you're at. And you guys helped me get into it, helped me with my first courses with Diana Tadros. I mean, that was a great education, a lot of fun, and definitely got me going. Yeah, you guys were at the very first printing lecture that I was at, and that's when I was like, "Dang, look at all this! I want to do this. I want to get into that."
Absolutely.
Yeah, that's another thing about exocad is they evolved the software. The evolution of software is actually really quick, and they seems like they do a really good job listening to technicians and dentists. I think when I started, and it was only say 3 years ago, it had been several evolutions of the software since then, at least 2 or 3.
Absolutely. And it's kind of misleading sometimes the way they name it. Like there's a big jump from 2.7 to 3.0, and then it's seems like such a small movement to go from something like 3.2 to 3.3, but the feature jumps from one to the next are just phenomenal. Like, well, first of all, the introduction of the AI crown. I mean, that's a pretty big award for just a point 0.1 number jump. But they do actively listen to the user feedback from technicians and doctors like yourself and try to grow with the technology every year. I think that's pretty awesome. Dr. Brian, do you have any particular cases that come to mind of where digital dentistry's really impacted your practice?
Yeah. Yeah, I got a few. So just in the last, a few months or so, I've been doing some restorative work. So some crown and bridge where I'm replacing like arch dentistry and then transferring like full arch dentistry from fixed, to implant, implant and dental born, restorative work. And so the really cool thing that we've been able to use, and it's really kind of sped things along, got me out of trouble, and you know, made things really predictable. That word we like, is being able to pre-scan. Say I'm doing a full arch restoration, and in particular, I was doing a full arch rehab on a case that I had done, a roundhouse bridge. From second molar to second molar, everything was splinted together. So I knew that I had to remove this entire bridge, and I had to start creating individual or segments out of this. And luckily, being able to translate that into implant born and tooth born. And what I could do was I could scan that whole arch. I send it to an evolved dental technician and did a digital wax up on that full arch. Then I was able to remove the entire restoration, take a finished scans as if I was going right to final. And then I sent that scan to an evolved dental technician, and they jumped the wax up onto the actual prep. It took them, patient was in the chair waiting for this to happen. From the wax up scan and the prep scan, they were able to marry those two, send me an STL file of at that time, just the provisional. And I was able to throw it on to my SprintRay printer and print a roundhouse provisional while implants were being placed. And so I was able to do that all in the same appointment while the patient was still numb and still waiting, still waiting for the restoration. And I was able to do all that at one appointment instead of maybe doing it into 2 or 3 appointments. And so that was really exciting. That was a kind of a game changer for me. And I could have done the digital wax up. I could have done the overlay of the files, but having that digital design technician on my side and able to do that for me while I was doing other things in the practice, made it really cool. I thought that was really, really exciting. And that was a bigger case. So that was something that was really cool to have that team. And if I didn't have the exocad, if I didn't have the scanner, if I didn't have the printer, none of that could have happened. I would have been going all analog.
How'd you feel going into that? Were you apprehensive about that? Was this kind of new territory for you?
That was new territory. So that was having that digital workflow in order to produce that, made things exciting and predictable and easier, dare I say. And it takes you, it just takes your work to the next level. So next level of outcome is there. And then on a smaller scale, I've done similar since then. I've done similar with 3-unit bridges or 6-unit bridges where I needed to get that, a tooth-borne provisional on while the implants are being done. I was able to jump those smaller cases too, still using technicians, but now I can do it myself. That teamwork with a technician, I learned from that, and I'm able to implement some of that on my own, and I appreciate that.
Sounds like you wouldn't be shying away from that in the future then either.
And no, I'm it does get me into, more knowledge doesn't necessarily mean I'm doing more. Like I know where I'm productive. I'm productive in my operatory. I'm not really as productive trying to do all my own design work and my own lab work. So I know where I need to pull back the reins a little bit and be where I need to be in my zone. But having that knowledge and having the ability to think through your process, your design process, definitely helps me in doing what I do in the operatory.
Sounds like you've used exocad as much of a teaching element for yourself as anything else. I mean, that's pretty cool.
Yeah. I, learning about parallel and how can I improve my preps? If I can improve my preps and I can digitize my preps better, then I know I'm doing a better job restorative wise. So, you see so much more when you're in the digital realm. So it definitely it ups your game as a dentist to be there.
What's something that you saw that kind of surprised you? Like something you encountered that you discovered you were doing that you do differently now, maybe, because of working with this technology.
Yeah, that's a really good question. That's one thing is though my prep designs changed. My comfort with the level of scanning has changed. So where being in scanning for so long, I used to just scan and send, and that rely on the digital technician to make sense of my scans. Make sense of my prep designs, and when you have an impression, when you take an impression, you can see you see everything in your impression, and it's different when you're digital. You got to think digitally when you take an impression, digital impression.
So how would you said your prep designs changed? How would you say they changed?
I'm definitely much more conservative with my prep designs. I'm way better at preserving tooth structure. I'm way better at identifying where I can preserve tooth structure. That also comes with great continuing education in the world of cosmetic dentistry and learning from the best dentists. What you can do prep design and getting away with the most minimal evasive dentistry possible, but digital, seeing things digitally and being able to overlay a crown over the top of your prep and actually see the distance between ceramics to prep, and and how you have enough room or you don't have enough room to be able to see that where you could never see that in an analog world.
Truly. And speaking of minimally invasive and cosmetic dentistry, you said you were a pretty early iTero adopter. Has using that orthodontic digital tool influenced how you practice dentistry?
Oh, absolutely. So, you know, haven't had iTero for so long, and haven't had that marriage with Invisalign. I I use that tool, the Invisalign tool or the aligner orthodontic tool, in order to create my the minimal invasive dentistry, the least amount of it, the most invasive dentistry I can provide to my patients using iTero their Invisalign, product. I'm big fan of that.
Big fan of.
That's big fan of that. Yeah. I know there's a lot of scanners out there that don't, have that connection, but I always looked at Align, the company Align, and how they've really got command of the market, the digital market. iTero, in my opinion, for years has been the leader in digital and digital dentistry. And then when they incorporated Invisalign, and then when they incorporated exocad, just seeing a company do that, that they have the knowledge of the resources and the technical side to take digital dentistry even to the next level. So I think that's pretty cool.
That is pretty cool. Shows that they have their finger on the pulse.
Absolutely. Yeah, there's some things I'm waiting for. Some other things I'm waiting for Align technology to incorporate. I'm excited.
Yeah, like what? What do you want to incorporate? What do you want to see?
Well, I mean, they have the scanning. They have the they have the aligners. I think they're going to attack the print world, and they're going to.
Really? Okay.
Yeah, I think they're going to take on some aspect of printing and take printing to the next level. If I was, on the board of Align, that would be my next vision. Would be getting the printing aspect of dentistry, incorporating all that, and having a grip on that.
There's a level of irony to it because, I mean, iTero essentially came out as a model milling company that happened to sell a scanner originally. I mean, that was their whole business model, was milling.
Really? I remember the mill model. Yeah.
They have, I don't know if they still do, but at the time they had, I believe, like multi-million-dollar 6-axis milling machines that no 3D printer at the time could compete with. And they were holdouts for 3D printing for a long time before they would be acquired by Align. So it's interesting to see how the changing landscape has pushed things in a new direction there, because now 3D printers are wildly capable of accuracy that no milling.
Yes. Right.
Regardless of the time being caught up, like the accuracy that you can get out of some of these 3D printers, even some of the cheap ones, is just unbelievable.
Yes. I definitely believe that, 3D printers are going to be what dentistry is going to be built on in the future. Having printed and gone to a mill was just the way for me to have control over my product right now in this in this day, in this year. Milling is there, but I definitely think that printing is going to succumb, past milling in the future. I see that coming.
I'd agree with that. I think that we're largely waiting on the advancement of some of the materials, and also for the insurance market to catch up, because let's be real, some of the reasons that we have these nanoceramic hybrids that we have now, the 51% infilled with zirconia powder, is just so that we can check a box on the insurance form so that it's a ceramic restoration.
Yeah.
Or at least that's my understanding of it right now. And I'm excited personally to see the material advances, because I think a lot of the printing technologies there. I mean, zirconia printing technically exists. There are 2 companies that print zirconia right now. But if you look at the product, it's kind of where, say, 3M lava was. Do you remember that?
Yeah.
Back when that first came out, where it's like, wow, this crown looks like chalk. But you did technically make it. That's cool, I suppose. It'll be interesting to see if that ever gains any headway, or if these nanoceramic competitors to, say, lithium disilicate will gain a foothold in the market. Because I agree, right now with the current technology, the current material science, like getting something like an E4 and milling a lithium disilicate, Emax being one of them, blue blocks, that's where the technology certainly currently is. And whether it'll jump ahead of that in the next couple of years, no one can truly say.
But I agree with you 100%. I think that these printers are, the technology is way impressive. And I think that it's just a matter of time before the materials catch up, for sure. I mean, I know you guys are printing titanium.
That's right.
So if you can print titanium, what's the boundaries there? Printing glass? I mean, seems simple.
It does seem simple in comparison, right?
Yeah.
And that's the other cool thing about, not to nerd out too deep on 3D printing, but that's the other cool thing about the concept is there's just so many versions of additive technology now, where you have extruded printers, like you can get just as hobby printers, that look like the robots that pass back and forth. And then we have, like you're talking about with the SprintRays, the resin printers, and then printing titanium. That's a whole other thing. They use a technology called SLM for that. So that's selective laser melting. And so it's a tray of powder that they're selectively melting the individual pieces, like tiny microscopic pieces of metal together. It's like all these very different forms of creating the same idea. So yeah, I think you're right. I think the future is additive. But the materials have to catch up.
Yeah. And I totally believe they will. I mean, these massive companies that have massive R&D, I know they're working on it, and they'll get there.
They'll get there.
Yeah.
Absolutely.
Yeah.
Any parting thoughts for us before we wrap up?
No, thanks for inviting me to talk with you. I'm a big fan of Evolved Dental Science and everything that you guys have done for me, from printing to milling to being my exocad support. I can always call you guys up and jump online with you for help in doing my digital design and get improving my workflow. I really appreciate, gosh, what you guys do for the dental industry is really awesome.
Dr. Olitsky, where can we follow you on the socials?
Well, being the old guy in the room, I do have social media, and I'm getting into that. So I am Brian Olitsky DMD, both on Instagram and Facebook. You may catch me a little bit in the TikTok world, getting my toes wet in that.
TikTok world. All right.
Yeah, in the TikTok world. Also, Small Stylist Training Center. I'm excited to help my brother out with that. He's amazing cosmetic dentistry, and he's taken his abilities to dentist. He's been doing it for years, but now he's got a Small Stylist Training Center in Ponte Vedra, Florida, and his courses are amazing, both cosmetic and no prep veneer courses, which is like his signature thing. And so I'm there with him, helping him out. And I know that you guys are big supporters of him, which is really cool. And so there I am. Facebook, Instagram, TikTok, YouTube. No, I don't want YouTube.
Thank you for listening to this episode of the Evolution of Dental podcast. If you like this episode and you'd like more like it, we're available on all your favorite major podcast streaming platforms, and we look forward to you joining us next time. Thank you.